So anybody else who has not, you are certainly welcome to join one of our classes, and you can go to our website at bwhi.org and get more information about all of the wonderful programs that we do have to offer here at Black Women's Health Imperative. We do both work with the pre-diabetes space as well as the diabetes self-management space. All right. Just housekeeping things. I just ask that if you're not speaking, please keep yourselves on mute because we can hear background noise and that's distracting to other participants. Again, like I said, if you have something burning and you can put your hand up and we will try to get to you. Or if you have a question, put it in the chat and either Laura or Aaron will let me know that is happening, and we will try to do our best to accommodate your questions or concerns. All right, with that being said, I'm going to tell you a little bit about Sharon Hawks. Ms. Hawks is the owner and director of the Nutrition and Diabetes Education Center in Glendale, Maryland. She is a registered dietitian, nutritionist, and one of the 19,000 elite certified diabetes care and education specialist in the U.S. Mrs. Hawks received her bachelor's degree from Michigan State University and her master's from Central Michigan University in the field of dietetics. She has over 25 years experience and has been listed in the National Directory Who's Who in Diabetes Treatment, Education, and Research. She is a popular and highly sought after speaker and consultant, both locally and nationally. Health professionals, businesses, churches, and the public are enthusiastic about her engaging, energetic, clear, and practical delivery of diabetes, nutrition, and health-related topics. She has appeared on numerous TV, radio, and podcast presentations over the years. Mrs. Hawks is proud to have served our country and is a retired Air Force major. On a national level, she serves on the board of the prestigious Black Women's Health Imperative, one of the oldest organizations whose primary focus is on the health and wellness of Black women and girls throughout the nation. Mrs. Hawks believes in practicing what she preaches. She takes pride in keeping her mind, body, and spirit in balance. And her motto is, your health is your greatest wealth, and without it, everything you cherish can be compromised. Her mission is to give others the tools they need to invest in this precious commodity we call health. And it is my absolute pleasure to turn this over to Ms. Sharon Hawks. Thank you, Sharon, for being here.
You're welcome. You're welcome. As you was going through that, I was wondering who you were talking about. and I must also add to my resume, as of Friday, I am a new published author. So I'm grateful for that. So please look up my book, Feed Your Fight. It was actually a book that was done in conjunction with John Hopkins and the CDC for Black women, breast cancer and nutrition. So a lot of good information in there. If you know anyone who suffered with breast cancer or you're trying to reduce your risk, it's a good book to look at. So, all right, I thought I'd put that plug in there.
Congratulations. And we will look.
Thank you. Thank you. So good evening, everyone. So I'm excited to be here. Just finishing up the book, so been really stressed out and over the top, but I am so happy that you guys are the last people I would speak to before I head out on a plane in the morning to Aruba for an entire week. So I am excited. So yeah, I'm excited to be talking to you guys because this means tomorrow I will be on the beach. All right. So I want to get started by just having a review. I'm glad Michelle asked a question about, can you guys hear me okay? I want to make sure my volume's okay. My granddaughter loves to play with my computer and she does some weird things. So make sure she doesn't change the volume. So I'm glad she asked a question about how many of you have been through training before. So I just want to touch on what I think some of the main issues to be most concerned about. Before we get into your questions, I want to just do a recap on what I feel are the most important things as it relates to diabetes prevention, as it relates to pre-diabetes, and how all these pieces fit together. Sometimes you have people going through pre-diabetes, the DPP program, or going through DSMES, and it's almost like they're two different worlds. What I'm going to try to do is merge the two together for you so you can see how one leads into the other. And I think it's going to answer a lot of the questions you had on your sheet. And if not, we're going to take the last half an hour to go over that. I like to teach more like a facilitator instead of an instructor. I think it works better than waiting to the end to ask all the questions. So if you can keep it brief, if I'm in the middle of talking about something, to keep it very organic. If you would like to ask the question, raise your hand and we can insert that right into the conversation. Is that okay, Michelle? Good. Excellent. So let me share my screen. Have you turned it over? Good. I can share my screen. So let me do that. All right. And again, just a few slides because I want to get you to the point of when we go into the question and answers that you've already kind of built up the tolerance for where we're going with this whole thing. So ask a dietitian. Here's the night. So I want to go through and talk a little bit about insulin resistance and pre-diabetes. Some of you have went through this before, but I want to do kind of synopsis so it all makes sense. Can y'all see the screen okay? Someone, thumbs up. All right. So if your goal is to prevent diabetes, you must start in the beginning. I always make the point when I go into classes, whether I'm talking about pre-diabetes or diabetes, there's an elephant in the room that must always be addressed if you're going to understand how to control this thing we call the beast diabetes. Okay, so what is that elephant in the room? It is insulin resistance. So let's talk about that a little bit. What is happening in the body to cause insulin resistance or pre-diabetes? How many of you have heard of insulin resistance before? Oh, I see. Michelle's the only one got a hand up. Oh, there. I see a couple more. Okay, good, good. So what I've learned with insulin resistance is that the topic is kind of skirted over and just a very mild introduction to it. But I want you to understand what it is because at the hallmark of it all, it is the ground zero to what happens and how you move into pre-diabetes, ultimately into diabetes. So how does it all start? We can look at this vicious this cycle of insulin resistance, but here's the thing to know. We don't know everything that causes insulin resistance, but we do know there are certain things that contributes. So if you look at this continuum, I want you to get the point that everything kind of feeds off each other and it's just this vicious cycles that occurs. So one of the first things we find is you eat refined sugars. Now I want to say this. Eating sugar does not cause diabetes, right? But eating sugar can make a bad situation worse. But when we start out with a diet that I believe more so of refined sugar, something we call ultra processed foods, it can cause a problem and make the pancreas overproduce insulin. And when this happens, it can cause the cell to become resistant. A lot of you have heard about insulin resistance and that cell becoming resistant. What is actually happening is the part of the cell that allows insulin to do its job to let sugar into the cell is no longer working as it should. So what ends up happening, the pancreas produces even more insulin to compensate for this insulin resistance. And insulin stores excess sugar as fat. Now you're gaining weight as well. The irony is the weight that you gain, particularly in the center area, is what caused some of the problems in the beginning. Then insulin resistance caused you to gain even more weight. Then inflammation ensues, fatigue, weight gain, sugar cravings, and you have this vicious cycle. And at some point, the insulin resistance can get so bad that the body's not able to get enough sugar into the cell, and ultimately blood sugar starts to rise and moves you into the pre-diabetic stage, ultimately into diabetes. Now, how long does this normally take? I usually tell people 2 to 5 years. If nothing is done to actively prevent diabetes, within 2 to 5 years, this process will move through. I want you to ask yourself, do you have insulin resistance? The truth is 2/3 of Americans do. Look at these symptoms. Any ones up there surprise you? tired after meals, craving carbs and sweet, can't go long without getting hungry, not satisfied after eating, brain fog. That's a big one, right? Where we just like we're kind of in a daze all the time. Inflammation. Do you know what inflammation feels like in the body? We talk about inflammation all the time, but have you felt what you thought was inflammation in the body? Anybody tell me what you felt when you think you have high inflammation?
Feel free.
Pain,
There you go.
pain sometimes. Yeah,
Joint
achy
pain,
pain.
And
Yeah,
swelling.
yeah,
swelling.
in the
And
joint.
a lot of these, a lot of what you're seeing here, of even the tired after meals and different things, inflammation, irritability. What I find a lot of times, the brain fog is a big one with inflammation. So be aware they're all connected. Belly fat, the visceral fat, that central fat in the stomach, I believe that this is kind of the hallmark too as well. You all notice that even if you need to lose weight, it wasn't a big issue until you start to expand in the waist. Did you realize that? Right? That's when the blood pressure starts to go up, cholesterol starts to go up, the blood sugar starts to go up. They're all interrelated. So I constantly get on my other health professionals about coming at patients and going, you need to lose weight. The issue is that you're going to gain too much weight. The reality is, it's not just about the weight, but it's where you're carrying the weight, right? Because I have patients who are overweight who don't have a lot of visceral fat, what we call the pear shape, right? All the weight goes to the bottom, and they don't have as much problems as someone who may be thin, but carrying all their extra weight in the stomach. So it's not just about being overweight, but more specifically where you carry that weight. You don't know how many patients come in to see me who have fatty liver. This visceral fat, which basically the difference between visceral fat and what we call metabolic fat that sits on the surface, visceral fat intertwines itself into tissue itself. So the type of fat that causes fatty liver is that visceral fat, which accumulates itself in that center area. Trouble losing weight. This is a big one because what happens when you have the belly fat, it increases cortisol, one of the stress hormones that cause you to uptake fat, and it wants to put it in the center area. And it makes it very difficult to lose the weight because one of the reasons for stress hormones is this anticipation that you have something that you got to fight against. You've heard about fight or flight. So it's not wanting to give up that fat at all. So it's a very difficult type of fat to lose. Dark patches on the neck, something called acanthosis nigricans. You got to remember that name. Just you've seen the dark spots on the neck, around people's neck, or in their skin folds. That condition is an indication of insulin resistance. In other words, a high level of insulin in the blood. PCOS, polycystic ovarian syndrome, one of the things that will render a woman sterile, have direct connections to insulin resistance and ultimately diabetes. And in fact, they treat PCOS with a diabetes medication. Did you know that? And a lot of times doctors never connect the dots for these patients. High triglycerides, that part of the cholesterol level, I like to call it the fat in the blood. People who tend to have high triglycerides levels, I love to say that they're couch potatoes. I call it the couch potato syndrome. Because typically when those triglyceride levels are high, they're not moving as much, they're eating a lot of simple carbs, and that's what's getting them in trouble. And ultimately elevated blood sugars, elevated blood pressures, elevated insulin levels, and dysfunctional gut microbiome. All these things are symptoms of insulin resistance. And we have a major problem in this nation related to insulin resistance because it leads to so many other things, not just diabetes. So who's most likely to develop insulin resistance? Being overweight, more specifically, that central obesity. Being over age 45, although we're seeing insulin resistance, pre-diabetes, diabetes in younger individuals, you would be shocked how often I see teenagers already with insulin resistance. A parent, a brother, a sister with diabetes. Which one of these first degree relatives, we call them, tells you your greatest risk of developing diabetes? In other words, if they develop diabetes and you didn't have it, who would concern you most? Who would you think it would be? A parent, a sibling, a grandparent? What do you think?
All of the above.
Which one tells you your greatest risk?
My sister.
Absolutely. More so the
Yeah.
sibling as a whole, right? because you're coming from two genetic lines. And how do we know if the disease passed through the genetic line? Is one of your siblings developed it, right? So make sure that if you have diabetes and you have siblings who do not, you need to explain to them their risk and how important it is for them to work to prevent. And of course, we know in the African American community, Native American, Hispanic community, we are primed for diabetes. Genetics are there that makes it a lot easier for us to develop it. Being physically inactivity, that's less than 30 minutes, 5 days a week. But let me say to you, any activity is beneficial. Don't think that because you can't do 30 minutes, 5 days a week, that you don't need to exercise. All of it counts. A history of gestational diabetes. This type of diabetes in pregnancy is really a precursor for diabetes. It's not if you're going to develop diabetes, it's when, because gestational diabetes is giving you a kind of forewarning of what's coming. We talked about PCOS or having metabolic syndrome where you have high blood pressure, high cholesterol, a large waist. These are the things that put you at greatest risk. So be clear, it's not just about controlling the blood sugar if you're trying to prevent diabetes or control your diabetes. You must look at all the different aspects that's going to play a role in your longevity. And that includes as well your weight, particularly your waist, high blood pressure, cholesterol, along with that blood sugar. So what do you want to do in order to reduce your risk, if you will? Lose weight. You already heard with the diabetes venture program, losing 5 to 7%. There's research suggests that if you have diabetes, losing 10% may take your blood sugar to the minimally back into the pre-diabetic range. You want to choose whole foods. I like to say eat closest to the ground as possible. Eat foods just like it comes from the ground, just how it comes into nature. When you switch over to ultra-processed foods, that's when the problem ensues. And we're not even talking about with just diabetes. There's some horrible research now about the issue of certain type of cancers. You know, I literally talked to a friend at church yesterday, and I have a thing that I always say, it's a key thing that keeps my spirit up. And always when I'm speaking to someone, I said, all is well. And so it's saying to you, everything's going well. And he goes, I said, what's going on? And they literally have found a mass in his wife's colon and also in her stomach. Not good, right? And so I need to give him a call today. I'm gonna try to give him a call before I leave. But a lot of the ultra processed foods they're linking this to a lot of the cancers. One of the big cancers that is wreaking havoc in the African American community and our males is colon cancer. And it's frightening to watch. And we're believing this ultra-processed foods, particularly in the form of ultra-processed meats, I believe is one of the biggest issues, right? Reduce your liquid calories and diet drinks. I'm not going to spend a whole lot of time on this, but if you would ask me the one thing you can take away in your diet that's going to give you the greatest improvement to your blood sugar, that's going to be those liquid calories. Soda juice, sweet tea, lemonade, fruit juice, Starbucks, energy drinks. Y'all know who you are. Right? You want to increase your fiber intake. Fiber is only found in products that comes from the ground. Fruits, vegetables, whole grains, beans, and nuts. You're not going to find fiber in milk and dairy and meat. It comes from the ground. And again, the closer it is to how it comes from the ground, the more fiber is going to be present. I always like to use a simple explanation. Apple, applesauce, apple juice. Which one's better? There's no question it's an apple, right? Exercise, move more, sit less. Exercise is one of the things that have shown to reduce insulin resistance significantly because it helps with improving the uptake of glucose into the cells. Excuse me. Incorporate healthy fats and protein. Contrary to popular belief, fat is not bad for you. We're more concerned about the type of fat. Yes, there are certain types of fat you want to stay away from, but there are healthy fats that you find in extra virgin olive oil and avocado, in your nuts, and a lot of your fatty fish. These are the things you want to go after, not what you're going to find in the fried foods and your snacky type foods and what we call hydrogenated oils. Those are the ones you want to stay away from. Portion control. Let's face it, we love our food and we love a lot of it, don't we? I am convinced that if we would just cut down on our portions, most of us can get away with eating just about anything we want to. We just eat way too much food, right? I bring out the measuring cups and I show people what a serving size is. You think you know what a serving size do? I show you. Let me see if I have my cup near. I was talking to a patient and I said, John, how much coffee you drink in the morning? He said, about a cup, Sharon. So I held up a cup, by the way, which is 8 ounces. He said, oh, I guess I have about 3 cups, right? A cup is 8 ounces. It is not the mug you're drinking out of, right? You have to understand what serving size are. You don't get to determine the serving size. There are parameters that you should look at. And once you understand serving size and start to put them into effect, you'll be amazed at how quickly your blood sugar starts to fall. A lot of you are eating healthy, but you're just eating too much of it, right? So work on those portions. Sleep, make it a priority. There was a question on the list, and I'll address it right now, where someone asked about their blood sugars elevated in the morning, I think, or late at night. I make the point, sleep a lot of times is the culprit. If you don't get enough sleep, your blood sugar will be elevated in the morning. If you don't believe me, watch it. Take the blood sugar before bed, get one of those nights where you get 3 or 4 hours of sleep and see what happens in the morning. Right? So sleep is not just important for the blood sugar, but it's important for your health overall. There's powerful research that suggests that people who don't get enough sleep tend to be heavier. They tend to be more prone to having high blood pressure, prone to certain types of cancer, and God forbid, dementia. So you do want to get that sleep. And stress management. There's research that suggests that the 2 things that's going to determine your longevity with quality is stress and weight. So stress is a big one because it tends to bleed on everything else, does it not? If you don't get enough, if you're stressed out, you tend not to sleep. What do you think about in the middle of the night? All the things that are stressing you out, right? You're not getting enough sleep. You tend to eat more when you're stressed. You tend to eat more when you don't get enough sleep. You see how they're just a vicious cycle that feeds off each other. So you got to make sure those 2 things are a part of your health, of the things you're doing to stay healthy. So insulin-resistant prediabetes are 2 related conditions that can lead to type 2 diabetes within 2 to 5 years if nothing is done to reverse the condition. And keep in mind that 2 to 5 years is average. I have patients who literally in 6 months, they were told to have prediabetes and lead right into diabetes. Because keep in mind, the day you're diagnosed with prediabetes, diabetes for that matter, is not the day of diagnosis. It's just the day that they caught it. Research suggests that you've had prediabetes or some form of insulin resistance for most people up to about 10 years before they're diagnosed with diabetes. 2 to 5 is just the average, so be aware of that. So which foods have the greatest impact on your blood sugar? This is another part I want you to get. Let's make this clear. What has the greatest impact on your blood sugar is carbohydrates as a whole. Keep in mind, carbs, sugar, glucose, starch, they're all the same thing. So when you hear the name, don't think one is worse than the other. We use glucose a lot of times to talk about sugar in the blood. Starches, a lot of times we're talking about specifically going for the pastas and the breads and the potatoes, but they all are carbs. Don't just think about cake, pies, candy, cookies, and sodas being carbs. Those other foods are too as well. So take a look at this. All these foods on this picture are carbs. Any of it surprise you? See, a lot of people are surprised by the fruits and what's up here that should be up here more prominent. The reason we don't always put it, lump it into the carbohydrates group is because they're lower in carbs. But be clear, vegetables are carbs too as well. You gotta know though that there are some carbs that are better choices than others. We talk about simple and complex carbs. So we know when it comes to the cake, pies, candy, cookie, and soda, juice, sweet tea, those are what we call the simple carbs. When we're talking about beans, when we're talking about fruits and whole grains, those are your complex carbs. Now, the reason why the complex carbs are always going to be the better choice is because they're high in fiber. And fiber, if you get nothing else I talk to you about the food, know that fiber is the one substance that has been proven to slow the rise in the blood sugar. So you've got to make sure every time you eat, you have a good source of fiber there to help to keep that blood sugar at bay. If you let simple carbs stand alone, your blood sugar is going to shoot through the roof. You're going to drop within an hour or so, and you're going to be craving more carbs. If you ever wonder why you're craving food all the time, typically it's because you're not eating high fiber foods and you're not getting enough protein, which is the only nutrient that has been shown to sustain your blood sugar, your sense of fullness longer. So when you eat, the two things that must be present, carb high in fiber and protein. Someone asked that question. That is your combination of food. I would like for you to also add a little healthy fat in there too as well, because that fat gives you that sense of satisfaction. It kind of makes everything taste better, right? So adding a little healthy fat in there would help with your sense of satiety, of your sense of being full as well.
Sharon, I'm
Yes.
just going to real quick point out something. Somebody said they were surprised by the grapes and the blueberries in the picture. And
That they're carbs.
that they're
Yeah,
carbs.
and fruits are carbs, right? And so that's whenever I do a class, you're not alone. People go, wait a minute, an apple is a carb? Yes, right? And so there's another picture I have that have a more extensive list than this on there to show you. But I want you to get that if it came from the ground, let's make this simple. Y'all can tell I'm Southern born and bred, so I like to keep things simple. If it came from the ground, it has carbs, right? So apple comes from the ground, just like grapes, right? Even when we're looking at bread started out from a grain. Isn't that correct? Your beans, all those, and even your vegetables, they are lower in carbs, the non-starchy version, but they're still carbs. Now, let me say this though, and this is so important to get. Just because it's a carb does not mean you can't have it. Do you know why carbs have such a big effect on the blood sugar? It's because they're the preferred energy source. It's what the body prefers to use to get its energy most efficiently. So why would you throw out the thing that the body craves the most? But the side effect of the body needing it and wanting it so much is that it can use it efficiently. That's why it sends the blood sugar up quicker. So the goal, hear my voice, is not to cut out carbs, but to learn how to manage them in a way that you can control them. So watch this. Here's a quick 3 rules for eating like a person with diabetes. Small meals, spread the carbs throughout the day. You don't cut them out, you spread them out. Some people will tell you, you can't have bread at all. Well, you can have 2 or 3 pieces of bread. You just can't have them all at one time. You spread. Never allow more than 4 to 5 hours in between your meals. This is a lecture within itself, but know that the body processes carbs within 1 to 2 hours. It processes protein between 4 to 5 hours. Fat, it can take up to 7 to 10 hours. But note, carbohydrates are converted into glucose in the blood 100% of the time within 2 hours. Protein, about 50% is converted, but that 50% actually doesn't affect your blood sugar because the body tends to store it. So your biggest culprit remains the carbs, not because they're the enemy, but because the body can use them so efficiently. So how do you take advantage of that? Spread them out and make sure that carb is high in fiber so it can buffer that rise. And then add that protein in too as well. The third point, combine the protein and the high fiber carb at each meal and snack, because that protein is only nutrient that has been shown to help you to feel full longer. You like that, right? The carbs, even though it's high in fiber, it's going to make you feel full initially. That feeling of fullness only lasts 2 hours. Protein is going to take you 4 to 5 hours. So combine the two together so you get the best of both worlds. Simply cut down on your simple carbs. We can't get around this because they're so concentrated and don't have any fiber with them. That's why they're going to be so detrimental to your blood sugar, right? So these are the ones I really want you to cut down on. They're undocumented calories. Too much sugar can cause that blood sugar spike. causing the pancreas to release more and more insulin. And that's the process that starts to elevate or move diabetes along. Insulin accelerates conversion of calories into fat, making it easier to gain weight. I made that point earlier. And the insulin stimulates the liver to make more cholesterol, and it may also increase your stress levels and indirectly cause problems with blood pressure and cholesterol too as well. They're all connected. The beautiful thing though, as you work on one, you tend to see improvement with the others. Bottom line, this is what your plate should look like. Half of that plate should be non-starchy vegetables, 1/4 meat, and 1/4 starch, and 2 carbs on the side. How are our typical plate looking these days? Half meat, half starch, and a side salad, right? I'm gonna need to have more vegetables on that plate because they're lower in carbs. Meat doesn't have a major effect on your blood sugar, but the reason we keep the amount of that down is because its relationship with cholesterol, heart disease, all those things, and weight gain. But it doesn't mean that it has a major effect on the blood sugar. And then the starches is the one that tends to have that greatest effect. So again, don't have to cut it out. Just cut down on how much you have at a time. So here's some of the examples of food you would see. So the non-starchy vegetable, your spinach, carrots, lettuce, green beans, your grains. This is where we're talking about your breads, your whole grains, your high fiber cereals, those type things. And then of course your protein is your meat. And for you who are vegan and vegetarian, we're looking at tofu and beans, those type things that also can get your protein.
Sharon,
I think I want to stop here. I think, yeah. Go ahead, Michelle.
I was going to say, somebody asked, is intermittent fasting something that diabetics should do?
Yes and no. So the no is, if you're on diabetes medication, I would say no. Because the issue is you have to have a certain amount of time. If you're taking a medication that you're taking twice a day or 3 times a day sometimes, you need to have a certain amount of time in between those medications. You can't start eating at 11 o'clock and take a medication and then take another dose at 6 o'clock. There's not enough time in between. They usually want those doses to be 10 to 12 hours. And there's not just diabetes medication. We talk about high blood pressure medication, cholesterol medications. There may be other medication you're taking. So intermittent fasting will not be indicated for that person. Outside of that, if you're not taking major medications that require a double dose during the day, you may be able to do intermittent fasting, but it really needs to be something that needs to be discussed on an individual basis because there's so many different forms of intermittent fasting out there. And so I'm asked a lot about which one do I adhere to. I think the 8-hour of feeding and the 16-hour fasting is probably the most extreme to me. I wouldn't go anything past that. I think the sweet spot is eating over a 10-hour window, right? And fasting for 14-hour window. The absolute anyone, regardless of who you are, shouldn't be eating over a 12-hour feeding period. So whether you're doing intermittent fasting or not, you really need to give the gut a break. I hope that answered your question. All right, you know what I'm gonna do? I'm gonna stop right here. I was gonna discuss A1C. There was a couple questions about the A1C, but for the sake of time, I want to give you some time to answer questions. So let's do that now.
Okay, sounds good.
All right, so anybody have direct questions or do you want me to go down the list? Michelle?
I think we could pull some off the list, Sharon.
Okay.
Let's pull some off the list.
All right, so some of the questions that was asked, I have to put on my glasses for this. I got a sheet here, I had it on the screen. About the A1C. The A1C number is equal to what average to your daily glucose. I had a slide, I don't think I brought it up, but the average glucose, for instance, if your A1C is a 7, you've been averaging for 24/7 a blood sugar around somewhere around 150, 160. Right? But imagine if your A1C is 10, you're averaging blood sugar is about 250 or more, that's 24/7. Because remember, the A1C reflects the average blood sugar for a 3 to 4 month period. And this 3 to 4 month period is an average 24/7, not just in the morning, not just in the evening, which brings up another question about the A1C and what does it mean related to your blood sugar. The A1C is 24/7. So if you're only taking your blood sugar in the morning, right? And you got these blue, beautiful numbers, and then you shock when your A1C comes back. Remember, it's an average 24/7, not just in the morning. That's the one that get a lot of people in trouble, which brings up another question. How often should you be taking your blood sugar? Keep in mind that the fasting blood sugar, let me exit out of this for a second. Keep in mind the fasting blood sugar is telling us where you're starting out for the day. It's a good number to kind of get you started because let's face it, if your blood sugar is 250 in the morning, you're going to be chasing blood sugars all day, right? But on the other hand, it's actually not the best indicator of how well your medication and your lifestyle is affecting your blood sugar. The best number for that is 2 hours after your biggest meal. That's the number that tells you if what you're doing is working. Which brings up another question from the list. When does the clock start at the 2 hour point? The clock started when the meal began, not when it ended. Your blood sugar will start to rise within approximately 5 minutes of the initiation of food. So if you're waiting till the meal is over to start the clock, you done lost about 15, 20 minutes, and you got a girlfriend of mine who eats really slow, it may be 30 or 40 minutes for you've lost, right? So start that clock as soon as you start eating the meal, not when you finish. Right? So that's the A1C. Any other questions about the A1C? Let's see, I was looking. Someone asked about a vegan diet and A1C. This comes up a lot, particularly with all the lectures I'm doing now related to cancer and to diabetes. And I get a lot of pushback when I make this point, but this is according to research. The research does not bear out that a vegan diet is the best way to go when it comes to diabetes. One of the reasons why is that for a person who's doing vegan, 75% or more of what they're intaking is carbs. And so a lot of times, because of the nature of the diet being so high in carbs, so you're going to have a very difficult time controlling that blood sugar. Can you do it? Absolutely. I have helped patients to do it, but most of the time, the average person clearly can't do it on their own, right? Because a lot of times people think just by removing the meat, that automatically makes me healthy. The truth is, I hate to say this out loud, but you can be a junk food junkie and control your blood sugar if you know the rules to eating like a person with diabetes. So it does not dictate just because the diet is healthy that it's going to automatically control the blood sugar. Right? So that's a big one to know. Any other questions about the A1C? All right, some of the other questions was about medications. So there was a question about Trulicity, I believe it is. Is Trulicity like Ozempic? Let me share my screen. I think I brought up a couple slides related to that. A lot of people have a lot of questions about Ozempic these days, right? And Wegovy and some of the other ones. So let me take a moment to address those. And I think if I can do that, if I can address those, then I can go into a little bit, answer some of the questions without doing individual questions. Oops, where did you go? All right. So weight loss drugs, Wegovy and Ozempic, some of the most popular semaglutides, which is a class of drugs. Ozempic is approved for people with type 2 diabetes, and it gives about a 15% weight loss. Wegovy is approved for people who don't have diabetes but who are overweight. Actually, now a lot of the doctors are doing off-label and in prescribing Ozempic even in patients who don't have diabetes, which is making it very difficult for the patients with diabetes to obtain the medication. The drug mimics a hormone called glucose-like peptides with GLP-1, which targets the brain that regulates your appetite. That's why it works so well. The question was asked about Trulicity and how it relates. Does it help with weight loss? Trulicity is actually an earlier version of Wegovy and Ozempic. And Rybelsus, Trulicity is in a pill form, as Wegovy and Ozempic is actually injectable. The weight loss tends to be higher, a little bit higher in Ozempic and Wegovy than in Trulicity. but it's actually a great drug too as well. So how does these drugs work? They lower your blood sugar. They slow the stomach rate of emptying. It helps you to feel full longer and curbs your appetite. They believe that they actually affect the hormone producing, the hormones in the body, something called leptin and ghrelin, that kind of dictates people who tend to be hungry all the time versus are not. The first thing you hear when people are taking these drugs is that they don't have an appetite for carbs at all. It kind of swashes their appetite for carbs. And when it does that, you're automatically going to see a lowering in the blood sugar and lowering in weight because they're not taking in all these excesses. Any other questions about the weight loss drugs? Because there was a couple of questions about other medications too as well.
I have a question. Do you,
Yes.
if you get the Ozempic, do you have to take that the rest of your life? Or
That's what the drug companies are pushing for, right? They're making billions right now. And that's what they're pushing for. And most people go on the drug do not want to be on it for life. But understand this: if you go on the drug and get off of it, research says you're going to gain back 75% of the weight you lost within 3 months. Right? One of the big reasons why I believe is because when you're on these drugs, no one talks about this, but you lose a lot of what we call lean body mass, muscle. And if you have a lower rate of muscle on your body, your metabolism is going to be lower, right? So if you stop taking the drug, because you now have a lower amount of muscle in your body, it makes it easier for you to gain back weight. This is why they talk about people who are on Ozempic having Ozempic face. Have y'all heard about that? Well, Ozempic tends to make people look older and not younger. Typically, weight loss make a person look younger, but when they're on these drugs, they tend to look older. And one of the reasons why is because that loss of lean body mass is not just in your arms and your legs, it's in your face and everywhere. So you tend to get that kind of drooping thing going on. Does that make sense? But if you strength train while taking these medications, I think it'll reduce your risk of gaining that weight back. So this discussion needs to be had. And then also, while they're taking these drugs, you have people just stop eating at all, right? That's not good, because that sets you up too as well when the appetite comes back. So it really is about getting with someone who can help you manage the drug in a way where you're losing the weight, but at the same time, if you decide to come off the drug, there's a good chance you won't gain all the weight back.
I think I'll stick to getting my mindset right so I can lose the weight.
Well, you know, the thing is, I go back, I don't go back and forth. I think it depends on who the person is. I honestly think if a person needs to lose 15 to 20 pounds, I wouldn't deal with the weight loss drugs. But if you have somebody needing to lose 75, 100 pounds, they really need to probably consider it because of the risk that comes with carrying all that extra weight, right? So you actually, does the risk outweigh, right? And I think it does.
Thank you.
Aaron made a great comment in the chat, and I wholeheartedly agree, is that that's why lifestyle change programs are so important, right?
Absolutely.
And I
Absolutely. They got to be a part of it. People want to do all or nothing, and it doesn't work like that. People have the best outcomes, even when they have bypass surgery and sleeve and all that. They really need to work with someone to ensure that they're able to keep that weight off. A lot of the weight gain back is because they never establish a healthy lifestyle. Exactly. I tell patients to come in and see me. Don't come to see me just for weight loss. You're wasting your time, because at the end of the day, if you don't come with the idea that this is a lifestyle change, this is just going to be a vicious cycle.
It doesn't matter what you do. And I, you know, people on here know that I advocate about this. I tell my story all the time. I've lost and kept off 25% of my body weight by way of weight loss surgery. I have the medications. I have a dietitian. I have a trainer. I do all the things because
all the things working together to help you to be successful. Absolutely.
Exactly. So
absolutely.
Let's see. Dr. Cameron has a question. Your hand is up.
Yep, go ahead.
So I do have a question about working out. Like currently I'm in an aggressive weight training program. So I lift weights. And so recently with my last measurements, I've lost body fat, but gained muscle, but the scale has pretty much stayed the same.
And you just explained why. You did it beautifully better than I could have. When the fat mass goes down, so kind of think of it this way: you hit equilibrium here. Fat mass goes down, right? Muscle mass goes up. You got equilibrium in the middle is what happens. Eventually, you will start to see it on the scale. But I always tell women, look at how your clothes feel and how you look. We get caught up in the scale, right? When I've had patients who are down 2 or 3 dress sizes and be like, all I lost is 6 pounds. This is ridiculous. You're down 2 dress sizes and their mind is still on that scale, right? But what the issue is, you're gaining that lean body mass, you're losing that fat mass, and you pretty much got equilibrium is what happens. The even more in-depth discussion is muscle is denser than fat. I've actually heard even on national shows, just drive me crazy, where you hear people, muscle is heavier than fat. What? Unless you can change the physics of the world, 5 pounds is 5 pounds. What the difference is muscle is denser than fat. So if you're looking at 5 pounds of muscle in front of me, it would appear smaller than 5 pounds of fat. But clearly, if you put them both on the scale, they're what? 5 pounds. So you get what's happening? So I know you're feeling it where everything's looser, you're thinner, but it's because muscle is denser that it doesn't cause that scale to move.
More so when they say, oh, lose the weight for, to help with your blood sugar.
Mm-hmm.
If I'm not seeing the pounds go away, is the muscle increase helping me?
So, absolutely it is, for several reasons, right? One of the big reasons is, and I didn't mention because we compact on time here, is that the one thing that has been shown to consistently reduce insulin resistance is strength training, resistance training, because it makes the muscle work, the muscle being the major part of where these receptor sites where insulin access to let the sugar into the cell. So what happens is by strength training, it reduces insulin resistance. So I tell women, once you get over 45 or 50, strength training becomes a big part of your regimen. Not that cardio goes away, but strength training must become a big part. If you ask a health professional like myself, how do we define how well someone's aging? It is muscle mass. Frailty means you have no muscle mass or you have limited muscle mass. So if you want to age well, you have to keep the muscle mass up, because what happens every decade after age 30, you lose 7 to 10% of lean body mass. That's a natural occurrence. It's not personal. It's what happens in the human body. Good news is you can counteract that by strength training to keep that muscle on. But if you do nothing, that's how frailty happens. You start to lose the lean body mass. So certainly keep up what you're doing.
Thank you.
You're welcome.
There's research that supports, slow, heavy, steady weights, but, make sure you have supervision with it is what really does support exactly what Sharon is saying.
Sure.
I'm trying to really like my new trainer because he's really into the heavier weights, and my old one was a little bit softer about it, but I keep saying it's for my good. So
Well, let me say this though. So Kim, I'm gonna have to get on the fence here, right? Because when you use lighter weights and more reps, it builds it doesn't build bulk, right? It actually builds muscle without the bulk. So I don't think there's no reason why there's no benefit for lifting heavier weights as you get older. Keeping lean body mass is just keeping the lean body mass. It's not having bigger muscles. So if the weights are heavier, it tends to build muscle, builds bulk, right? But lighter weights, more reps actually builds tone. Yeah. All right. What other questions do you have? I think I answered the question there was 2 questions about medication. I answered the one on Trulicity. Farxiga, I think someone asked about Farxiga. I can't remember what the question was, but I think I had a slide on that. And metformin. Metformin is it is the most prescribed diabetes medication. Newly, I would say, Ozempic probably is now, but I'm talking about for newly diagnosed patients. It's most prescribed. The side effects of metformin include the nausea, vomiting, diarrhea, stomach pains, and gas. I always tell patients, if you get to me before you get taken off metformin, I can probably keep you on metformin. The reason why a lot of people have these side effects of metformin is because they don't eat when they take it. You must eat when you take metformin. And I guess I can say this with the group. I always say to a certain group, eating means food, not a few crackers. Well, I had a little crackers, I had a half an apple. That is not a meal. Right? When I say eat when you take metformin, I'm talking about with the meal. And there's some people that they may even benefit from completing their meal and taking their metformin after the meal or during the middle of the meal. Because the metformin is the first thing that hits the stomach in the morning, it will mess you up. You have got to have a decent amount of coating on that stomach before you take metformin. Other thing to know about metformin, that it tends to cause a deficiency in a lot of people with B12. So you may want to take a B12 supplement if you're taking metformin. And that B12, keep in mind, unless it's been injected, if you take B12 orally, 75% of it is degraded in the stomach. So you might want to make sure you get a form that's sublingual. You know what sublingual is? Where you place it underneath the tongue and you hold it there for about 30 seconds or so. It's absorbed through the lining, through the little capillaries, and you'll get more absorption that way. So make sure your B12 is sublingual. And then the other question was Farxiga. Farxiga is what we call the SGLT2. Some of the side effects, it does help with weight loss too as well. Lower blood sugars, it can cause hypoglycemia, so make sure you eat when you take that too as well. The biggest issue with Farxiga and the SGLT2s is a lot of patients are prone to urinary tract and yeast infections. And here's basically why. It reduces the reabsorption of filtered glucose in the kidneys and increase elimination of glucose in the kidneys through the urine. In other words, instead of the body absorbing the glucose to be used for energy, it kicks it out through the urine. So think about that. If sugar ends up in the urine, what kind of problems can it cause? We know that yeast loves sugar. And the only thing it loves more than sugar is warm, moist places. So that's why you're more prone to the yeast infections in the urinary tract. Now, if you're not taking in an extreme excessive amount of sugar, it's actually a wonderful drug. But if you're one of those ones who are constantly taking in way more glucose, way more carbs at a time, you're probably going to have some problems with urinary tract and yeast infections. All right.
Someone asked, what about Jardians?
Jardians is the same categories with Farxiga, I believe. So same principle, the same class.
Okay. Well, it's about 3 minutes after the hour. This has been a wonderful, most informative session, Sharon. Thank you so very much.
It's a lot. We could have gone at it for a whole nother hour. I know you guys got a lot of other questions, so we'll definitely have to do this again.
Well, we definitely will. We're going to try to host them quarterly, so stay tuned. And we'll get Sharon back to answer some more questions. And for those of you who have been part of our classes, thank you, thank you, thank you. If you're not quite done, please finish your class. You get armed with some more information. If you've not taken one of our classes and you are in that pre-diabetes or you've been diagnosed with diabetes, you still need the lifestyle change, please sign up for one of the classes. And you can go to bwhi.org and fill out the risk test for the pre-diabetes. And if you want the diabetes class, you fill out a form and Erin and I will come directly to us and we'll get you signed up for a class. If you have friends, family, mom and them, brothers, sisters, anybody that you know who could benefit from these programs that we're offering, please share, please let them know, because we will welcome them, because our whole mission is that everybody would be able to live well and not, experience the complications associated with diabetes that is not well managed. So we don't want to see that happen, and especially for our folk, right? Our brown and Black brothers and sisters, we want everybody to be able to live well and get this information. So please, 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 please share. And we do our best to help. So Sharon, once again, thank you. I just love you. Appreciate
You're
you.
welcome.
And you're always such a wealth of information and you're so passionate about it. So thank you for giving of
Good.
yourself in that way.
Excellent.
And
Thanks for all you guys do as well.
absolutely. And with that, I will say good night and live well.
Good night, everyone. Pleasure. Heading to Aruba.
Have a good
Good night.
vacation, Sharon.
Thank you so much. Blessings.
Bye.